I would like to give an analogy. It's, for instance, if a country is spending millions of dollars and they don't know exactly what they are spending. It's almost like, you have a ship, but you don't have a compass, right? So you don't know the direction in which you're going. If you have to change the direction of the response, you really don't know how you're investing. So that's exactly what it is. If you have a country without, I wouldn't say necessarily NASA, but without good quality expenditure tracking data, it is like you don't have direction to your response. It doesn't help in the sustainability process. You don't know what are the issues, where is the funding gap, how to reallocate resources, how to plan for increased domestic resources, where to plan, which region to plan, which program to change, who are the beneficiaries. If that information is not available, it's really difficult for any kind of decision making for HIV program or health program in the country.
Can I draw the analogy of my own personal budget? At the beginning of the month, I get my salary and I think, oh, this is terribly exciting. And at the end of the month, all the money's gone. I have no idea where it's gone. I haven't got half the things I needed to get. I have no idea whether I'm going to have a shortfall in the coming month. That's what it's like. If you don't track first of all, plan what you want to do and how much money you need, and then track how the money has gone to those things. At the end of the month, the year, your response is in a state. You don't know whether you are going to ever achieve your treatment targets because you haven't got enough money for ARVs. You don't know if you're going to turn off the tap because you haven't been spending enough on PrEP or male medical circumcision. So in my mind, it's a no-brainer. You have to do this if you want to manage your response. Be more efficient with the dwindling resources, spend it better, spend it more wisely. Make sure that programs spending is equitable. If we didn't have that, you'd spend more money in the provinces that have a greater demand or a greater voice, but maybe you're missing the regions that have as great a need, but they didn't have the voice or had greater needs we weren't aware of. So really, I think our response would be in a terrible mess if we weren't tracking the resources. And I've seen that HIV has been quite unique because it's mobilized so many resources and a joint global effort. And because we've had to track the money and be accountable and prove what it's done, I think HIV leads the way in resource tracking. And through my work, I've really been able to use my experience with NASA to track other disease areas, TB, nutrition, immunization, hepatitis. So HIV's led the way in many ways, and I think other disease areas or other issues, it doesn't even have to be in the health sector, education and social development. They've all learned so much by what we've done in the HIV field and our resource tracking. And myself personally, I've seen incredible progress in 20 years